back to our live streams here from Sonoma County Wildlife Rescue. Thank you so much for joining us on this sunny Thursday. Today what's going to happen is we're going to walk you through what happens when an animal comes into our care. And so we'll start off with our common responses to calls about injured or orphaned animals. From there, we'll head back to the treatment area. We'll take a look at a couple young orphans that just came in. And after that, we'll talk about how we manage any wounds or injuries, that most common types of situations that they might have. And so if you ever find an injured or orphaned animal, when you do, the first thing that you should do is call us. Call us at 526-WILD. Depending on the nature of the situation, there's a whole range of responses that may be appropriate. And so the person who's going to receive those calls is our front staff, Kelsey, and so she's going to jump on in and just for a couple minutes review the scope of appropriate actions we may take in response to a call about an orphaned or injured animal. So I will go ahead and give up the seat for a moment. Thank you guys all for joining us. And so when we get that call, here's going to be the friendly face that receives it.
Hey guys, I'm Kelsey. I'm the Community Support and Volunteer Coordinator here at Sonoma County Wildlife Rescue. I deal with a lot of administrative stuff, and with that I answer phones and handle animal intakes here. With the phones, a lot of the phone calls we get are for animals in need of help. And there are a few common situations that we get with that. Of course, we can get a whole range of things, but a few of the common ones are an animal that's that is either sick, injured, or orphaned that is in need of our care. In those situations, we will either depend on the finder to bring the animal in, or we'll send out a rescue team. When I answer the phone, I quickly work with the finder to evaluate the status of that animal. If it is in need of care, a lot of the times we do just have to educate the public on whether or not the animal is healthy and just living its normal life out in the wild, or if it does need to come into care. So we'll evaluate that and decide the best course of action, whether that's bringing the finder in, or bring the animal in with the finder or with a rescue team. We have wonderful volunteers who rescue our animals here for us, and a handful of staff that we can rely on in case those volunteers are not available. In certain situations, we do also try to reunite any orphaned animals with its parents. A lot of species will come back for their animals, or for their young. The most common ones that we do this with are squirrels, raccoons, and a handful of other species as well. And then when an animal comes into care here, they come in the front door, and this is the front desk that they're greeted at. We quickly take the animal back to the hospital where they begin the intake that we're going to go through next. And we have the finder fill out this yellow card. This yellow card stays with the animal throughout its stay at the Wildlife Rescue. It gives us information on the finder and how the animal came in, and on the back our animal care team updates it with specific notes on it. So with that, I'm going to give you back to Dr. Dan.
All right, so because I know people are coming in and out of these live streams, I'm going to try to keep track of the sequence of events on our board here. So when we get a call, there's a whole wide range of possible responses, from just releasing the animal back, to trying to reunite, to having the owner bring it in, to having one of our staff go out to get it in. So eventually, one of the possible outcomes is that the animal will come in for an intake to our center. And so this chart right here shows us the animals that have come through so far this year. The first few months at Sonoma County Wildlife Rescue are always slower times, the first few months when it's winter. But now we are already starting to get into our busy season. We have not one, not two, but over 80 animals currently on site in our care. The vast majority of those at this moment are going to be opossums, part of the seasonal ebb and flow that comes and goes with our wildlife community. And so we also have started to get raccoons coming in, but squirrels and opossums are the most prevalent ones at the moment. And opossums are going to be one of the species we get in bigger numbers in general. And so we've had a few hundred animals come through so far this year. And like I said, of that few hundred, 86 are currently on site at the moment. And so after an animal comes in, the first thing that we'll do is it'll head back to our main treatment area. And so let's walk on down the hall. This entire facility, we do have just one main building here. It is a converted house. And then we have all the different outbuildings, some of which you guys have been seeing these last couple of weeks with our live streams. And so we'll head on down to the end of the hall, and so to what we call the hospital or main treatment area. And so this is a home that was part of the zone around actually the dump, the recycling center, that had to be reclaimed by the county for that purpose, and the county lets us use this facility. And so we're going to head on in. And so after an animal comes in, welcome. So they're going to, the first thing you're going to do when an animal comes in is you are going to just stop and pause and take a moment. So we're talking about wild animals. We're talking about animals that have been out free-ranging, and one of the most stressful things that can happen to them is being in the hands of people, being in the hands of captivity. And if you push too hard, if you move too fast in terms of rushing towards trying to assess that animal, you can stress them over the edge. When you experience stress, there's a surge of different kinds of hormones, your fight or flight hormones. And if an animal is sick, which an animal would have to be very sick for a free-ranging wild animal to be able to be picked up for all those adults, then they're on the risk of being pushed over the edge. So we would pause and take a break, not do anything dramatic. After we've had time for the animal to acclimate, then we'll take a look at it. If they have a severe injury, we might just give them some pain meds, maybe some fluids, and then again, let them have another break before we jump in. And so we happen to have a number of animals that have been coming in every day lately, including a handful of orphaned opossums. So we'll do a quick intake exam on one of these guys and see how they're doing. Danielle, are you able to give me a hand?
Yes.
All right. And so this is a group of 5 opossums, I believe. All right. And so with all animals in our care, it is important that we're able to keep track of them. It is important that we're able to see how they do day over day. And so at this age, they're pretty handleable. But you still want to make sure that you are being safe. All right, I don't know if you can come and closer on this individual. And so at this age, this would be one that was probably with a parent, but is certainly independent on its own. And so this is one where if the mom was under some stress, she might have dropped or abandoned the offspring, correct?
Correct.
And this is very common this time of year in terms of these opossums. Okay, I'll go ahead and shift to the scruff. All right, got it. And so for the purpose of exam, we do want to make sure we look at a full multiple organ system exam, just like you've seen your veterinarian do with your dogs or cats. And so I'm just going to maintain control of this individual just with a scruff on the neck. And so we'll take a look at all the major organ systems. So eyes, ears, nose, look at that mouth. We'll give us a nice look at that mouth. Check out how many teeth these opossums have. They have twice as many teeth as humans do. Now these are still baby teeth, there's still more to come. But anyway, and so looking for things like any injury to them, any ulceration, and then we'll go ahead and feel down those limbs. All right. So checking for any evidence of any broken bones, any birth defects, any things where they wouldn't be able to have full normal mobility and motion. Go ahead and look at the rear end as well. And so every animal has different normal parameters, what's normal for them. And so opossums, for example, have a lower body temperature than most of the species that we're used to. All right, so, and then our stethoscope is, let's shift it on that side. All right, take a quick listen to this friend. We'll listen to the heart and the lungs. In some species, it's also important to listen to the gut sounds. So a good healthy heart rate is varying. We're talking about 110 beats a minute or so, which is fine. Sometimes when they're more anxious, they'll be higher than that at this age. Lung sounds. Not taking big breaths just because the animal's a little bit anxious, but respiratory sounds that are appreciable are nice and normal. And so then we'll palpate that abdomen, make sure nothing feels abnormal in that aspect. Take a look at the skin overall. It is very common for an animal to be that is debilitated enough to come in to have evidence of parasites. Yeah, there's a little bit of flea dirt on this individual. And so also I'm just going to go ahead and set them down. Also, just assess hydration. You assess hydration by looking at how moist the gums are. Right now I'm checking what's called skin turgor, how readily the skin will head back towards its normal position. And just want to note, this is an orphan opossum. They can tolerate this kind of intervention, and we don't usually talk through this process. We're usually trying to be as quiet as possible. Certain species, just this much talking would be profoundly stressful to them. And so, but this is an individual that should be able to handle that for this one single experience. And so feeling for any enlargement on lymph nodes, which doesn't seem too dramatic. And it seems like a little bit dehydrated, but otherwise fairly healthy little fellow. All right, so you might notice we have a couple bottles of very fancy marking material here. And so we do need to make sure that we have a litter of 5 that's part of this group. We do need to make sure that we can tell them all apart. So when they get a little bit older, we will use an ear tag on the opossums. For other species, we use microchips, the same kind of microchips that your dog and cat probably have inside them to individually identify them. But at this young age, those techniques are not yet a good option for us. And so we'll just put a little bit of color and that will come off over the course of a couple weeks, but by then they should be old enough for us to use other marking techniques.
Should I get on with this?
If you don't mind, thank you. And so one thing we're going to do for this individual right away is make sure that it doesn't get too dehydrated. And so what we're going to do is we're going to give it some subcutaneous fluids, some fluids under the skin. And so this is a technique that you might have seen happen with your own pets at the veterinary clinic. If you've had cats that have things like kidney disease, it might be something that you had to do at home with your own pets. So the process is going to be comparable. For any species that does have a big scruff that is carried around by between that shoulder blade area, there's this big loose area of skin here, and we can put fluids under there as a means of rehydrating. For us, our humans, our skin is so tight that if you put a lot of fluid under the skin, it would be quite painful. And there's some species, like guinea pigs, that don't have a big scruff where it's not an option. But of our wildlife, most of the mammalian wildlife we get in, this is our choice location. For birds, we use a completely different location. All right. So Danielle, how is this going to be logistically easiest here? Are you used to holding and administering at the same time? One person holds?
Yeah,
How should we go about it?
You can hold him for me, and I'll mark him and spray him for fleas and give him the subcutaneous fluids.
Okay. And so the other voice you're hearing is Danielle. She's one of the registered veterinary technicians who works. We have 2 individuals with an RVT license here at the Wildlife Center.
Tell me to weight check too.
And so, should we weigh before we give the fluids?
Mm-hmm.
All right. So I'm just going to zip this guy over to the scale.
You said it was a female?
How did you sex the possum?
By looking at the genitalia. And so I'm just going to zero out our scale here. Okay. And we are weighing a mighty 62 grams.
I think you need to put the lid on.
I mean, we are weighing a mighty 129 grams indeed. And so that's approximately 4 ounces for those of you who are used to other forms of measurement. All right. So it'll be cleaned up for our next patient. All right. Head on back around. Okay. So we're just lifting that skin and placing this fluids, and you can give up to 5% of the body weight. The amount that's appropriate will vary depending on the species, both in balancing things like how much fluids their body can handle, and balancing things like how often we want them to be touched and handled. So we'll often give a little bit higher doses less frequently in wildlife than we'll do with domestic animals. So that was a flea spray. This animal is too young for us to be using the topical or oral flea products that we'll use on older individuals in terms of controlling their ectoparasites. All right, so what will happen to this friend from here?
He'll go with his siblings who have already been examined, and he has a house set up with food and water.
All right, so we can go ahead and move them on in. Are they in?
Yeah, this way.
All right.
They're going to be observed in the hospital for a couple days before they get to move on to the nursery.
So we have this guy set up. Okay. All right. We can join your companions that are already ahead of the game. go. And so we'll go ahead and let her have her ray. And so in here, this is our main hospital location. And so we've poked our heads in here a couple times before. But if you guys want to take a look in our incubators, and again, thank you so much to everyone who donated on our incubator appeals. Both of them allowed us to upgrade these incubators. Here we have a group of actually orphaned raccoons. Oh, is it too much of a glare?
Yeah, maybe
All right.
stand. Oh, here, I got it. I can just hover over it. Maybe.
All right, and so we won't be spending too much time in here. I'll give one chance to try to see if we can decrease that glare.
Here we go.
Is that better?
Yes.
All right, so that happens to be a group of orphan raccoons. And then we also have many groups of opossums in here as well. And so we're not going to open up all these guys because we don't want to stress them out. A lot of them did just have their care. You can also see we have some of our enclosures. After they get out of the heated incubators, we'll often move into these enclosures for some of our younger fellows. And then the older ones will end up in these if they still need hospitalized care before we shift them to outside. So that's what happens at the intake. We get initial assessment, initial treatment, and then we make a plan for future. In the case of that individual where it's healthy but just orphaned, the treatment plan is pretty straightforward. We'll just give them the supportive care but closely monitoring in case any evidence of disease does come up. And so we'll be reassessing each of these individuals at least every day. Now, sometimes we get animals with overt injury. And so in that case, that triggers a different sequence of events. And so if we have an injured animal, then we'll have to, sometimes it's going to be something like a superficial injury, and the extent of the injury is relatively straightforward, and we can treat that with something like bandaging care. And so in terms of bandages, some of the materials we use are all ready for us here. And so a lot of you are going to be familiar with things like vet wrap. And one of the most common concerning things I hear is someone says, oh, I have some vet wrap at home. And this will come in a lot of different bright colors. And we'll just apply that over a wound of an animal, whether it be wildlife or whether it be a domestic animal. Now, if you just use one layer, that is going to be very damaging to any animal. If an animal needs bandaging, first of all, you're going to want to make sure they have at least 3, sometimes 4 layers. And so the first layer, the lowest layer, is going to be what we call the contact layer. A lot of possible things we might use for that. 2 of the most common things we might use are something like these Telfa pads. This is going to be something that looks a lot like the inside, that middle white square on a Band-Aid. And so this will often be what we'll do to place directly on a wound itself. Another thing we may use is something like these Tegaderm films. These are thin, flexible films. I'm not going to open this one up because we will need to use it for a patient in the future, but especially if we have avian skin or some of the more dynamic corners of the patient, sometimes that's a better contact layer. There's a wide variety of possible contact layers. What you use depends on the details of the wound. After you put your contact layer on, then the next layer you're going to add is going to be your padding layer. And so the padding layer is going to protect that wound both from the outside world and from the final layer as well. So we will literally use cast padding for our most common contact padding layer. And so we'll roll that onto the patient's wound. And then if need be, we'll also do a little bit of a cling gauze to shape that padding layer. And then last of all, we'll actually put some of our vet wrap or some of our holding or tertiary layer. And so because we see a lot of small patients here, in addition to the typical rolls that you may be familiar with, we have to cut some of these in half or even a quarter so they're the right size for our patients. And so, Danielle, can I borrow your finger for a moment?
Sure.
All right. We're going to bandage your finger.
Should I take my glove off?
Sure. All right, so let's pretend you have a wound right here. So if you were a raccoon, or an opossum, or a fox, and you had a focal wound right here, what we might do is we'd have to flush, clean, treat that wound. We would then, when we're ready for bandaging, first put our padding layer, or our contact layer on. Then we would roll our padding layer on, and so we're going to roll that on so it doubles up, 50% overlap each time. And I'll head down on the arm as well. All right, then we would move on to our cling wrap, our shaping layer. Again, usually at 50% overlap. And I go to try to tear this, and oh no, I can't just tear it with my finger. So, let's go ahead and use our scissors. And then lastly, we will go ahead and add a bit of our vet wrap. So another special, there's lots and lots of little rules about bandaging. And so, one rule is you never just put this on straight from the package. You always have to loosen it up. These are made for small patients. All right, and so after it has already been pre-loosened, then we'll apply it and we'll roll it out. Because otherwise it wasn't pre-loosened, the act of putting it on can crank it on so tight it can function like a tourniquet and be a problem. And so the layers of the bandage are just one of many considerations in terms of how frequently we change the bandage, what kind of ointments or topical treatments we might use, the exact details of placement. They can all vary. For a typical bandage like this, we then also may just secure it. Oh, this last part was a little bit tough. With a little bit of tape above and below. But like I said, there's lots and lots of rules and considerations for bandaging. So Danielle, what fatal error did I make if I was trying to bandage for that area?
For here, there's some fat wrap that went off the padding.
A little bit. And also, will this stay in place?
There's no stirrups on it.
There's no stirrups or anything to keep it anchored in place. If you ever have a wound, I would have to go above the joint above. Otherwise, what will happen is it just slides down, and all that work was for naught. And so, I want to make sure that you guys don't just try to bandage wild animals at home. There's lots and lots of subtleties and rules to it. But that's just your primer on some of the main key concepts. And so, if you have an animal that's injured, often if it's more than just a routine, mild kind of first aid level of injury, when it needs major veterinary care, that'll wait till myself, the veterinarian, is here on site. And so I can either meet the patient here at the center, or I'll meet them at one of the veterinary clinics I work at Pet Care, who kindly lets us use the facility to treat wildlife. And so, for example, one of the patients I was in recently is a mom opossum, an opossum that had a litter of 7 or 8 babies inside. And she had recently had major head trauma. And so most likely was hit by a car. And so she came in, she was weak, we gave her pain meds, we gave her fluids, and then the next day I gave her the full veterinary evaluation. And so on x-ray, it was determined that her jaw was broken, as well as having that eye that was popping out of the head. 2 very uncomfortable, very concerning injuries. And so, but she also had babies in the pouch. If the babies weren't a concern, we would have sedated her and dealt with everything all at once to try to patch her up. However, because we were worried about those babies, we can only do very short procedures without risking compromise to those offspring. And so the jaw needed to be stabilized. Now, luckily, there was no single oblique fracture on one half of the jaw. And so I was able to use a very quick technique to wire that jaw shut. After the opossum was sedated, I put 2 needles on either side of the jaw, passed wire around that injury, and was able to twist it tight and shut, and as well as, of course, cleaning and prepping for that surgery and that surgical site. We started her on a lot of pain meds to manage things, and after the babies were big enough to come out of the pouch for a couple hours, then we were able to deal with her other issues and remove that non-visual, permanently damaged eye. And so far, she's doing great. In fact, she just moved not just out of the hospital, not just out of our nursery area, but out to an outside enclosure. And so her second procedure happened a couple weeks ago, and she and all her little babies are doing great. And so, have there been any questions?
A couple. Let's see here. How long has it been since you got an injured animal?
So we get injured animals all the time, and so we've had a couple injured animals in this week. There's a raptor, a kite that we're going to x-ray tomorrow to see what's going on with that one. That's a very high stress animal. You have to be careful, so that'll be taken care of tomorrow. And so basically we get injured animals in every week. With the short answer, whether it's just a couple or whether it's a large number, will vary on the week.
And then an observant eye, I know the answer to this one, saw Margaret pull up, one of our rescue volunteers, and wanted to know what she was bringing in. And she's also bringing in another kite, a juvenile, I believe.
Okay, so another, and a kite is a species of raptor.
Yes.
All right.
That's it.
Okay. And so yeah, so the
I do have more.
Yes.
How does she eat with her jaw? Wire jaw.
Gotcha. So that opossum, part of the reason we had to risk that sedative procedure even while those babies are so young, is that first day she was with us, she wasn't eating. Even with pain meds on board, it was too unstable for her to eat comfortably. Once we wired that jaw, as of later that day, she was eating normally. And so she's been doing great. Now, the wire is still there. After her babies are completely out of the pouch, I'll go back, sedate her one more time, remove that wire, and should be able to go on to be released herself as well.
How do you determine if an animal is ready for release, and where do you release them?
Excellent questions. All right, so there's two questions. I'll do the second part first. Where do we release them? So by state law, the only, maybe national law too, but the only place that we release animals is in the immediate vicinity from where they were found. And so if an opossum was found on your property, then we need to go back and release it on that property or as close as we're able to access. In terms of when they're able to be released, for orphans, part of it is going to be guidelines based on size in terms of when we know animals are generally capable. The other criteria in terms of injury, we often will have to put animals through a series of assessments to make sure they can do the normal things. This may be things like hiding food in places to make sure they can get to areas to access it. In the case of predators, we may have to make sure they can catch a rodent in terms of like prey testing. And so if it's developmental, we usually know developmental landmarks when they're safe to release. In terms of injury, well, both in terms of our physical examination of their bodies and then assessments of how they can function will help us determine when they're ready for release.
Do opossums have nipples inside the pouch? If so, how many?
They do, and it's a lot. The exact number I'm not quite sure, but it's over a dozen. But absolutely, there is nipple-like structures inside those pouches.
And then somebody's asking if the possum will be released back in the wild, the mom opossum.
Yes, we have and so her babies are, and so she's a little bit early yet in terms of the maturity and development. We're going to wait until those babies are ready to be independent on their own. But all signs are pointing to that mom being able to be released. Yes, she will only have one eye. But opossums are going to navigate the world primarily by smell, and so as long as they have one visual eye, they are generally considered releasable. We will, of course, put her through those same assessments we're talking about, making sure she can find food, that she can find resources. But as of now, all signs are pointing positive. Now, she is an appropriately wild opossum. She's not all that fond of human attention as we want wild animals to be. And so we didn't bring her out today so that we don't expose her to extra stress, but she's doing great down at her enclosure.
Perfect. I think that's all we have right now.
All right. And so thank you guys so much for joining us on this Thursday as we talked about what happens when an animal comes to our center, and then the initial intake evaluation where they have a tender plan, and then just a little bit about some of our wound management. Every case is a different story in terms of the sequence of how long it'll be here, how much intervention it'll need, but we do go over, and so that's just a taste of some of the flavor of things that we may be dealing with. Next week, we will be talking all about foxes, and we will likely need to shift our time a little bit, so watch the Facebook announcement in terms of, it'll probably be on Wednesday instead of Thursday. But I appreciate you guys having the opportunity to spend some time with us for this live balance or whenever you're viewing it, and everyone stay safe out there.